Okay, well, good evening, everybody. I wish that we were all in the same room. It's so much more fun that way. However, we are working under exceptional circumstances, and so we will sally forth. And I would at first like to thank Michael and his team for putting on this series, and this evening will be the kickoff, the first one, and it's concerning, obviously, long-term care planning, what it is and why we need to prepare. And here is our agenda for this evening. We're going to have an overview of what long-term care is because a lot of people don't really understand it. We'll look at a few of the planning misconceptions around long-term care. We'll look at the continuum and the costs of care. People are always interested to learn more about what governments do and do not subsidize. There's been a lot of talk about for-profit versus not-for-profit care, and we'll be looking at funding options. We'll talk about the care conversation. We will talk about Alzheimer's disease and related dementias for a couple of different reasons. I will provide you with some summary slides of closing thoughts, and then resources, which I will expand on when we get there. Before we begin, I'd briefly like to introduce you to the man who put me in this seat for the last 25 years. It's my dad, Ralph Henderson. And my father died 20 years ago of the flu and long-term care. He suffered from vascular dementia and probable Alzheimer's, which we now call mixed dementia. Because of stroke disease, he suffered from aphasia, which means he lost the ability to speak, and dysphagia, which means he lost the ability to swallow. My dad also had terrible spinal arthritis, which put him in a wheelchair for the last years of his life. So I think my dad stayed alive until 94 to teach his daughter what it was like to age in Canada. And 20 years ago, it wasn't great. And now in 2021, we see what COVID has revealed, and in many cases, it's horrific. So we all have different personal situations and family situations, but regardless of our situation, we all need to know the following. How does the long-term healthcare system work? Where can I live happily and safely? How do I fund this? Does the government pay? Do I pay? And if so, how much? How and when do I start planning? And where do I go for information? So let's begin with an overview of long-term care. Long-term care is not acute care, which is provided by hospitals as a result of an emergency. It is a variety of services and accommodations provided to people who are chronically ill, disabled, or who have a cognitive impairment such as Alzheimer's, like my dad. Long-term care has never been designed to cure. Good long-term care provides an environment where people can age with independence and safety. Most long-term care, in fact, over 80%, takes place in the home, but it also takes place in rehabilitation hospitals and, of course, long-term care homes. Now, most people also think that long-term care is medical, but it really isn't. Most of it is what we call custodial, which means that it provides assistance with what we call the activities of daily living: bathing, dressing, toileting, transferring, continence, and feeding. These are the 6 things that we need to be able to do to maintain our independence and live on our own. How long does long-term care last? Well, it doesn't last just the number of years of care in the home, because quite frankly, in this country, we don't track that. And not just the number of years in a care facility, which at the moment is about 18 months. The real answer is we don't know because we don't have enough data. Let's move on to the long-term care planning misconceptions. There are many, so we'll just touch the top. Misconception number 1, I won't need care. Reality, too many Canadians think their present good health will go on forever. It won't. Think COVID. And this is an interesting Health Canada infographic, which actually I find quite surprising. 44% of adults 20 and over have at least one common chronic condition. The leaders being high blood pressure, osteoarthritis, and mood or anxiety orders. And by the time one reaches 70s, 80s, and 90s, people can have as many as 10 chronic conditions. Misconception number 2, I understand the costs of long-term care. The reality is that according to a 2016 survey, 3/4 of Canadians admitted that they had made no provision for long-term care and they had no idea of the costs of long-term care. Misconception number 3, I'm too young to need long-term care. The reality is that 40% of people receiving long-term care are under the age of 64. Accidents, illnesses can happen to anybody. And I would bring your attention to Michael J. Fox, who got Parkinson's at 29. Christopher Reeve was paralyzed after a riding accident. Selena Gomez suffers from lupus. Lady Gaga has fibromyalgia. Halle Berry and Tom Hanks have diabetes. So nobody is exempt from the need for care. Misconception number 4, long-term care planning can wait. I've got lots of time ahead to do this. The reality is that 50 is the ideal age to start planning for care. Unfortunately, people seem to have the number 65 in their minds, and too many wait until this age when too often something has already happened. And so that if we plan early enough, we can avoid the decisions that we may live to regret. Now let's move into the long-term care continuum. But before we begin, I'd like you to know what all Canadians are facing right now. Over 500,000 adult Canadians have unmet home care needs. That means that they cannot age in their own homes because the government is not providing them enough subsidized home care and they can't afford to pay privately. And over 38,000 Ontarians are on wait lists right now for long-term care and nursing homes because of a lack of availability of home care and because we simply do not have enough beds. And this was before COVID. Let's move into the long-term care continuum. And this continuum is the path that we take through the healthcare system as we age and need more care and support. So stage 1 of the continuum is home and community care. And poll after poll tells us that this is where seniors want to age, in their own homes, aging in place. It's safe, it's familiar, they can be around loved ones, but the problem that we have just seen is that there may not be enough subsidized home care for you to remain in your own home, which means that the individual must pay privately. And what does this cost? Well, it costs anywhere from $28 to $80 an hour, depending on the service that one needs. So from an annual perspective, $35,000 a year will buy you about 4 hours of private care a day. And it goes as high as $100,000. And how did I get that number? One of my neighbors about 5 years ago was at home dying of cancer, and he wanted to stay there for as long as possible. Pardon me. So his family hired 2 24-hour caregivers 7 days a week, and the cost was $10,000 a month, and that was 5 years ago. That number is pretty stunning, quite frankly, to most Canadians. Phase number 2 in the continuum is retirement or assisted living. These homes are privately owned and run, and they provide carefree living in a secure environment. Care is there, support is there. The people who move into retirement homes are independent, and they pay a monthly rental fee, and if you require care, you can purchase a separate care package. There are no subsidies for retirement home care, and the cost ranges anywhere from $4,000 a month to $12,000 or over, depending on the type of accommodation selected and if a care package is purchased. Phase number 3 in the continuum is nursing or long-term care or memory care. These are the homes that were in the news the most during COVID, and they may be owned by for-profit or not-for-profit organizations or municipalities. But regardless of who owns them, they are legislated by the province, and they must provide 24/7 chronic care or memory care and supervision. Now, in this case, the government pays for food and care, and the residents pay for accommodation. The rates are set by the province, and for Ontario in 2021, the rates range from $1,900 a month for a ward level room, which means that there are at least 3 people in the room, to $2,700 a month for a private room. And lastly, on the continuum is palliative or end-of-life care. And at its best, it is integrated planned care, which is headed by a palliative care physician with a skilled team. And their main concern is to provide optimal pain and symptom control and also family support. Now, palliative care can take place across the continuum, but there is admittedly a very limited availability of palliative care, and when it is available, it is generally paid for by the province. So as we look at the continuum, the biggest confusion people have is between retirement home living, let me get my little pointer here, and nursing home care. And the main difference is that there are no subsidies for retirement home care. You pay the full freight. In nursing homes, the government does pay for food and care, but the residents pay for accommodation. And the other difference is that if you want to go into a retirement home, you are free to apply to any home you wish. But if you need to go into a nursing home, you must apply through the province and be approved as needing 24/7 care and or supervision. Let's move on to talk a little bit about for-profit versus not-for-profit and municipal homes, a very hot topic in the era of COVID. Let's review, first of all, the situation of long-term care in Ontario. We have 626 homes and approximately 78,000 residents. 58% of the homes are for-profit, the highest proportion of private sector involvement in this country. 24% are not-for-profit or municipal. Who owns the for-profit homes? These are public chain companies like Chartwell, Sienna, Extendicare, and Revera. They're traded on the Toronto Stock Exchange, investment vehicles such as REITs, and private ownership. Let's hone in on for-profit homes. During COVID, there was an awful lot of trouble in all homes, but when a lot of research was completed, it was shown that for-profit had the worst outcomes. Not every for-profit, but a lot of them had the worst outcomes because of COVID. Why? Because they had lower staffing ratios, lower wages and benefits for the staff, higher staff turnover, and they had staff moving from home to home, which was spreading COVID. With respect to quality of care, they had a higher prevalence of pressure sores or ulcers, more hospital admissions, and a greater use of excessive and inappropriate drugs, including mood-altering medications. And finally, as we've seen earlier, their infrastructure is old. They own most of the province's older homes. They have most of the ward rooms. And unfortunately, too many of these homes have not been renovated the way they should have been. They are at a 1970s level. And you'll find this graph interesting, that Ontario has 33% of its beds in ward level, followed by British Columbia way back. So you can see how many beds Ontario has in a ward level situation, which was one of the reasons that Ontario had so many deaths in long-term care. Let's move on now to government care subsidies and funding, always at the top of people's minds. People are often confused about what governments do and do not subsidize. So let's clarify it here. First of all, under subsidizing, governments subsidize physician, hospital, and diagnostics. And the reason they do this is because these are part of the Canada Health Act. Long-term care is not covered under the Canada Health Act. Governments, as we have seen, provide a limited number of home care hours per week. We know that they pay for the food and care and long-term care. Residents pay their accommodation, which is called a co-payment. The government will subsidize some senior expenses, therapies like physio and others. And they do subsidize a program called the Assistive Devices program, which I will talk a little bit later on in the resources section. What governments do not subsidize. We know that they don't subsidize retirement or assisted living. There is no caregiver compensation provided by provinces when a family member has to leave a job or take a leave of absence to provide care. Each province has what we call a formulary, a drug formulary, on which are drugs that the government subsidizes. These are not as unlimited as one would wish. And in fact, many of the very expensive drugs, for example, cancer drugs, are not on these drug formularies. There is no coverage for dentistry unless it is an emergency performed in a hospital, and very little coverage for optometry. So the big question is then, is how much money will I need? Well, that depends. It depends on the cost of care, where you live, your present and future health, your objectives, where you want to live and live out your life. Do you want to remain in your own home? Would you like to move to another part of the country? Would you like to move into a retirement home? The type of care that you want. And finally, your longevity. And this is very interesting. There's a wonderful website, a Canadian website actually, called Living to 100. And what I suggest you do is visit the website and complete the questionnaires. There's about 5 of them. And they look at lifestyle and nutrition and family and everything. And when you've completed it, they will, the algorithm will give you a number to which you will live. And plus it will provide you with a report on things that you can do to improve your health. So what I would suggest you do is that, first of all, you go through the exercise, and then you bring the number and the report to all of your professional advisors. And let's look at what our funding options are. We know that there are government subsidies, not as good as we would like, and government pensions, OAS, CPP, and GIS. We have the reverse mortgage, which you may or may not be familiar with. If you want to investigate it, go ahead, but I highly recommend that you seek legal advice. Of course, you have your personal investments with guided wealth management. You may look at downsizing, and people right now in this crazy real estate market are thinking, well, I'll sell my expensive house, but then where do you live? Because everything is full or very expensive. If you're lucky enough to have a corporate pension, that can fund your care. And there is a living benefit that we call long-term care insurance. It is an insurance product that has been designed to fund long-term care, but unfortunately not very many Canadians know much about it. Let's move on now to the care conversation. And it's a conversation that many of us intend to have, but we somehow don't get around to it. So let me start with the 40-70 rule. When adult children are about 40 and parents are about 70, it's time to start talking. And this conversation could and should last for months, even years, before everything is worked out and a plan is made and decisions are made. And what you need to do during this time is kids and parents need to talk. They need to know what parents want to do as they age. Stay in their own home, and maybe they need to look at renovations, or would they prefer to move to a retirement home? This is all part of the care planning conversation. How do you start it? It can be difficult. Sometimes the parents don't want to talk. Sometimes the children don't want to talk. So here are some ideas for you. One is ideally when a parent is still well and able to tell you what they want. That's the time to talk. When a parent gives you an opening, such as, when I die, I want so and so and so. Or when an older friend suffers a health crisis or enters a home, that can start the conversation. Or you may explain that you've been updating your will and asking parents if they had done something similar recently. But the most important how and when is before a crisis hits, before it's too late, when decisions are made that may later be regretted. Next, you want to call a family meeting. And how do you do this? Well, you create an agenda and you gather everybody around a table, which these days may be a virtual table, and you list family concerns, decisions to be made, issues according to urgency. Maybe mom and dad need a professional assessment, but the main thing about a family meeting is let everyone talk and contribute about what they think is important. And if possible, assign tasks to families. So if there's a lawyer in the family, perhaps he or she can look after the legal issues. If there's a healthcare professional, he or she can look after the medical issues. And obviously parents should be in this meeting if at all possible. Now, if there's discord in the family, conflict, it's worth hiring a facilitator for this meeting, and this person may be a social worker, a religious leader, the lawyer, or an accountant. An individual that the family trusts and an individual that has nothing to gain. After the family meeting, it's important that you make a list of all the informal supports available in the neighborhood to the family, friends, neighbors, places of worship, and the local community supports in the area, such as day programs, Meals on Wheels, home care suppliers, respite care, and friendly visiting services. It's a great idea at this point to set up a relation with your local health integration network, which recently, I believe April 1st, is now the Home and Community Care Support Services. Talk to them, learn what they offer, and that way you can stay on top of wait times for home care or admission to long-term care. So the HCCSS, formerly the LIN, formerly the CCAC, sorry. These are the gatekeepers to subsidized home and long-term care. So they're very important to know about. Everybody belongs to an HCCSS by virtue of your postal code. Finally, with respect to the family plan, you need to write down a plan to share with family, which will contain medical condition information, care needs, legal information, who's going to be the primary family caregiver, the financial situation, how care is going to be paid for. Driving is always a big issue. If there's any issues with that, how is transportation going to be supplied? And finally, the research that needs to go into this, care costs, and where parents may live, either in their own home or in a retirement home or a care facility. Whoops. And these are the care planning documents everyone needs to have. Financial records, an updated will, powers of attorney for property and personal care, and also advanced care directive information. That is the guidance that parents provide children about what they want at the end of life. Now, this can be a separate document, or it can be a part of the power of attorney for personal care. But these documents must be maintained and updated and made available to those who need them. Now we're going to switch gears entirely, and we're going to move on to Alzheimer's disease and related dementias. This is one of the most critical reasons that we need to plan for long-term care. I know, because after 14 years with my dad, I know what we did right, I know what we did wrong, and one of the things we didn't do was talk about Alzheimer's and its progression. We're talking about it because there's a rapidly rising risk of Alzheimer's disease and dementia. Right now in Canada, over 500,000 people, Canadians have dementia. 65% of those are women. And it used to be thought that it's because women live longer, which is true, but there are other reasons that more women get dementia than men, and they are involved in how quickly women's brains change, and also hormonal differences between men and women. We have one case of dementia diagnosed every 9 minutes. That's Alzheimer's, I should say, and it is the most significant cause of disability in those over 65. But the thing about Alzheimer's is it can strike much earlier. What we call early onset or familial Alzheimer's can occur in an individual's 40s or 50s. There is no known cause or cure for Alzheimer's disease, in spite of the billions of dollars that have been spent and continue to be spent on Alzheimer's. The key really is risk reduction. But before we move ahead anymore, I really want to touch on something called age-associated memory impairment. It's, I think all of us go through times when we forget something and we panic and we think, oh my God, what's happening to my brain? But really, memory changes are normal as we age. So age-associated memory impairment, or AAMI, means, or some of the signs are that you can't remember details of a conversation or an event that took place a year ago. Maybe you meet somebody on the street and for a moment you can't remember their name. You forget where you put your keys. We've all done that for sure. You forget other things and events. You occasionally have a problem finding a word, but you are not worried about your memory. You are worried about your memory, but your friends and relatives are not. So little things are niggling at you, but they're certainly not impacting your quality of life. It's normal age-associated memory impairment. However, things get more serious with the 10 warning signs of dementia from the Alzheimer's Society of Canada. Sign 1, you have memory loss that affects the way you live. You have problems performing familiar tasks, using the telephone, using the refrigerator. You have problems with language. You are disoriented when it comes to time and space. There is impaired judgment, problems with abstract thinking, misplacing things, seriously misplacing things, changes in mood and behavior, changes in personality, and finally, loss of initiative. Now, this is a wonderful infographic from the Lancet, and what it shows is the 12 modifiable risk factors. Remember that I told you that there is no cure for dementia. The most that we can do is modify our lifestyles. So here are the 12 modifiable risk factors. The first is education. The more education, the better, because it builds up what we call cognitive reserve. The second is blood pressure. Control your blood pressure. The third is hearing. Have your hearing checked, no matter how old you are, because there is now a proven link between dementia and hear loss. Number 4, don't smoke. Number 5, don't become obese. Number 6, if you have depression, treat that depression. Number 7, avoid social isolation. Becoming socially isolated has proven to have tremendous implications for cognitive health. Number 8, don't be a couch potato. Exercise at least 150 minutes a week at a moderate level, and that's at least now 150 minutes a week. Number 9, if you have diabetes, control it. Number 10, drink moderately. Number 11, avoid basically hitting your head. So if in your family you ride bicycles, you ski, you do other sports, wear helmets. And finally, number 12, the newest risk factor is air pollution. What scientists and researchers have found is that those who live in particularly polluted areas close to major highways have a greater incidence of suffering from dementia. So we can control all of these. We can't control our age. We can't control our genes. We can't control our family history, but we can control these. So I have a little bit more for you to remember, as if I haven't given you enough already. Why don't we care about long-term care planning? Because we certainly should. Well, it's easier. I mean, quite frankly, we're apathetic. We tell ourselves, I will remain healthy. I may live a long time. We don't know. We haven't been to livingto100.com. My family will look after me, provide support. Have you talked to the family? Have you had the care conversation? The government will provide for me. Well, we know that how well that doesn't work. I'll stay in my own home. Maybe, maybe not. I don't know how much care costs. I don't need to think about it. I've got time. Or I have enough money. And let me tell you about time. When I was looking after my father, he had a will and he had a power of attorney for property, but he did not have a power of attorney for personal care. And when I found this out, I panicked, got the paperwork done, and had my dad sign the document. 2 weeks later, he lost the ability to sign his name. We don't always have time. Now, when I ask you what your most important asset is as you age, what do you think that might be? If you answer money, you're very right. Having money as we age is critical. In fact, my father hammered into me, you don't want to be poor when you're old. But we're not talking about money here. We're talking about independence. It is what we all want to maintain as we age, but we need to plan for it. Here's how you do it. In your 50s and 60s, you manage your legal directives, your powers of attorney, and your will. Make sure that you have a say in your care, no matter how old you are. In your 70s and 80s, look at your home and what surrounds you. Consider downsizing to make things easier. I'm sure some of you have downsized a family home. I downsized my dad's, and it's a lot of work. In your 90s and 100s, stay connected, spend time with others, and maintain your purpose and hope. Remember the issue of social isolation. When my dad was still at home after my mom died and I used to go up and visit, he would always say to me, oh, Karen, let me wash your car. And I would always say, oh, Dad, it's okay, because remember, he had pretty bad spinal arthritis. Ultimately, however, I gave in to him. Why? He needed to do something for his daughter, and he needed to have a purpose. Quite frankly, the keys to successful aging are family and money. So here is your summary action plan starting today. Number 1, keep yourself healthy and out of the healthcare system for as long as possible. Number 2, understand the diseases that you face now or you may face as you age. Keep your home safe as you age, and we'll talk a little bit more about this in the next webinar. Tell all of your advisors what you want as you age. The biggest gift that parents can give adult children is to tell them what they want as they age. Ensure that your legal paperwork is updated and available. Make sure that all critical information is in place. Everything about you, all the documents are in one place for easy access. Start planning on how you will pay for care as required, and keep moving. Remember those 150 minutes. And I'd like to just point this out to you. Dr. Paul Dudley White, professor of cardiology, was one of Harvard Medical School's most eminent teachers. He always stressed that exercise had major physical and mental benefits, and he practiced what he preached. Every day for years, he rode his bike to Massachusetts General Hospital, and he remarked that if you want to find out how flabby your brain is, feel your leg muscles. Or, as Abraham Lincoln remarked, I've got 2 doctors, my left leg and my right leg. Very wise. So here are your resources. I always provide these so that you can explore them as you wish, and we're going to go through some of them in greater detail. So let's start with the Home, Community, and Residential Care Services resource. All you need to do is Google this title. It's a provincial government resource, and when you go here, you can read about home care, finding a retirement home, a long-term care home, and many other things related to the provincial government. So it's an it's an excellent resource. Second is the Assistive Devices program that I mentioned earlier. And this is a program that will help you pay for equipment and supplies. So on this website, you learn how you qualify, how to apply, how much is covered, what is covered, and so on. It's an excellent program, and again, all you need to do is Google Assistive Devices program, and you may just want to put Ontario in there. Our next resource is Cognicity. Now, this is a brain healthy resource, and here you can go and test your brain health, improve your brain health, learn more about brain health, and get involved. You can take your assessment here. I've been involved with this website for years, taking biannual assessments. It's a great website to stay on top of your brain health. Remember, we talked about age-related memory loss. Well, one resource that you can read about that is this terrific book by Martha Weinman Lear, Where Did I Leave My Glasses? The What, When, and Why of Normal Memory Loss. And what I'd like to read is some comments about this book. So your memory's not what it used to be. You forget people's names or what you were just about to say or why you went into the kitchen. You often forget where you left your keys, your wallet, your glasses, and so on. And you worry, you wonder, could this mean I'm losing it? So this award-winning journalist explains this kind of forgetfulness, why it happens and when, and what can be done about it. She interviews many professionals as well as friends and strangers about memory lapses. And she talks about topics as fresh and provocative as the upside of memory loss, the difference between his and her memories, why we are actually wired to forget, and what the future holds for memory enhancement. You'll learn things you never knew about why your memory behaves in such maddening ways. You'll find comfort and reassurance, and you'll probably see yourself on every page. So I did read this book and I thought it was terrific, and I highly recommend it. You can either purchase it or you can get it from the library. And here are my resources that are available to you. We have my website that's got lots of articles and information on long-term care planning. It's Never Too Early to Start the Care Conversation, a guide for adult children and their parents, and I'll go back to this in one moment. I've created the Practical Planning Guide. I've created the Critical Illness and Long-Term Care Planner, which is a place to put everything about a person needing care, from their nickname to their end-of-life wishes. And the newest addition to my tools is the 10-Step Long-Term Care Planner, which is a pamphlet that asks 10 questions, and when you go through and do the work and answer the questions, you've pretty much created a long-term care planning blueprint for yourself. Now here is the resource, It's Never Too Early to Start the Care Conversation. Now this is a PDF handout that you're going to receive as a thank you for attending this webinar. And the Care Conversation resource has been designed to get families talking about issues that affect us all as we age: our health, our financial situation, our legal and our social situation. And as I said earlier, the time to start the care conversation is now, before a crisis makes us make decisions we may later regret. So I hope you enjoy this resource, and I hope that you find it useful. Now, in our next session, we're going to be looking at what has happened to long-term care since COVID. So we will get a little bit more involved in COVID, but we're going to talk a lot about aging in place, because COVID has shown that many people are hesitant to look at moving into a care home. So we'll look at how to age in place, and then we'll talk about the most common long-term care planning questions that I get asked, reasons to plan now, some more summary slides, and as always, resources. So here is my contact information. Once again, I thank you for your time and your interest. I hope that we have been helpful, and as always, again, I thank Michael and his team so much.
Thanks, Karen. That was fantastic. You've ever had a good meal where everybody stops talking? I noticed on the Q&A it was very light, although I did get a couple of text messages from sneaky clients. So I'll turn on the microphone so that you have the ability to say, you have the ability to ask a question, Karen, directly. I did have one that I wanted to ask, and then I've got a couple of others if no one else is going to ask all the questions. But with 38,000 people waiting to get into long-term care facilities, are there any shortcuts? So a lot of these subsidized homes, some do asset tests, some do income tests to see eligibility. Are there ways that people that are on ODSP, do they get a priority? People getting the guaranteed income supplement?
Well, every province handles this differently, but I would basically say you can't jump the queue. The only way that an individual who is on a list can go to the head of the list is if there is a real emergency. If this person is at risk remaining in their own home because they may forget to turn the stove off and set the house on fire, or if there has been a terrible fall and the individual clearly can no longer remain in their own home without 24/7 care and support.
Excellent. If there's questions, go ahead and put your hand up. I'm just clicking through, turning on some chat functions. And then what I've done on my end, back in the day, 2012, I don't know if you guys can see that. That is my Sun Life long-term care insurance package. I got that in my early 30s. went to a presentation about 4 or 5 years later where they asked who has long-term care. And in our industry, it's a lot of older, primarily men. Myself, my other colleague here at Guided Wealth, we both put our hands up. We were the only two people in the room. Long-term care insurance is very, very similar to disability insurance. It's done on the same criteria. Like Karen said, this is primarily about your ability to do daily tasks. It's not about your where you're located. So as insurance companies have revised, most companies are no longer selling long-term care insurance. They sell disability insurance or critical illness insurance with the ability to convert at age 65. So there's always options. Oh, go ahead, Majid.
Okay, can you hear me?
Yes.
Good afternoon, and thank you very much for putting this wonderful presentation here from both of you, Karen and Michael. Karen, I have a question. First of all, we didn't get to the point that the product that you are offering. Probably you want to set it up for the next meeting, or when we go to your website, can we get a quote from there or not?
What
I
product?
understand that we should do a lot of pre-work to get to the point that we should be ready to identify what I really need, and then according to that, we get a quote. But when we get to the point that I know, for example, what I need, can I get a quote in your website? How is proceed to the next level?
What product are you talking about?
The long-term care product. I mean that.
Oh, long-term care insurance?
Yes.
Okay, that was what Michael was referring to. Well, yeah, long-term care is a product which I don't sell. I can teach about it, but you need to go to insurance. You should go.
Oh, okay, I understand. I was thinking that you are a provider as well.
No, I used to sell long-term care insurance, but I no longer do.
And most of these products are just go 2 out of 6 of ADLs should be. You should have it, then it kick in. Yes.
Yes, the product kicks in when you cannot do 2 of the 6 activities of daily living. You know, the bathing, eating, transferring, and so on. Yeah.
Sure.
Perfect. Yeah. So, and Majid, long-term care insurance, disability insurance was always very popular for self-employed individuals. A lot of the long-term care insurance you have through your group employment plan cannot be converted. It has to be a separate policy, either your disability through work or your critical illness if you have it through work. These are not convertible. It is becoming more and more popular, especially for the younger generation who changes jobs much more frequently, to take out one of these convertible policies that cover you for disability or long-term care, because the criteria for both are the same. Karen, why don't you stop screen sharing so people can see more of you?
Sure.
Or in that case, when you're saying that it is people are going for it should treat it like critical illness, so means that the underwriting will be as severe as a critical illness. I mean that when you go for the critical illness, it's a rigorous procedure to go for the underwriting. Is it the same here as well or not?
It is.
It's going to be worse.
Okay.
Gina,
Would be
go ahead.
underwritten similar to a disability policy because your daily habits come into line more than on a life insurance policy or a critical illness policy.
Mm-hmm.
That was Jackie Walton. She
Sorry.
works with us now. We can't see her, but I just wanted to introduce Jackie. Works and does mostly insurance now for Guided Wealth Management. A couple of other things, Gina, I'll get to you in just 1 second, I promise. And thank you for reminding me, Karen. Karen has a 2-part series, but the second webinar will take place in about a month. And we actually have a 3rd webinar planned for Thursday, September 9th. And that's with the AVP of Tax, Estate, and Legal for Manulife. So he's going to be talking about the pitfalls in common mistakes when a will is done. So the objective of this is not to race out and go buy long-term care insurance. The biggest objective is really to start that family meeting, and the idea behind how can this be afforded. Karen also alluded to her opinion of a reverse mortgage. These are last resort options. A reverse mortgage is just credit facilities There's other ways to do the same type of planning that are significantly cheaper. Gina, go ahead.
Yes, can you hear me?
Yes.
Okay, thank you very much, Karen. Thank you, Michael. I really enjoyed that. It was very succinct, very informative. I just wanted a clarification. You talked briefly about you had power of attorney for your father, but you didn't have something to do with his care. And I was wondering if you could clarify the difference, what you were talking about. Like you needed another document to ensure that you made choices about his care. I wasn't sure what you meant.
Yes, we all need to have two powers of attorney, one for property, for our money or for our real estate, and the other for our personal care. And these may be called different things in different provinces, but essentially everyone needs two different documents. And the power of attorney for personal care gave me the power to make decisions about my father's care. So where he lived, what treatments he got, what he ate, what he wore, everything about his personal care. And it's a very challenging job, quite frankly. And I keep meeting older people, particularly older women, who don't have a problem finding somebody to manage their money, but they cannot find somebody to manage their personal care. And it's a very demanding emotional job, and it really helps if the power of attorney for personal care has had personal experience providing care and support for another individual. So there are definitely two documents that need to be signed, and so that an individual's care and property can be managed when that individual is no longer capable.
Okay, I'm calling from Quebec, so I'm wondering if that's what we would call a mandate, which is different than power of attorney, or I don't know if it's the same thing in Ontario, having a mandate. So I'm still a little not clear.
I believe it is. I believe it is. Yeah.
Okay, that clarifies it. Thank you very much.
You're welcome, Gina.
One quick thing to add to that is that the power of attorney you put in charge of your finances does not have to be the same person in charge of your health decisions. They can have two totally different people. Always make sure that the health, you're assigning health decisions to people who share your views on how you want to, your last days if you can't make those decisions for yourself to be handled. Right? A banker might not be your best choice to take care of your health. David, go ahead.
I don't have any questions.
Oh, sorry, I saw your hand up. One last question I have, and it's about the family meeting. A lot of times care for a parent is primarily based on proximity to that parent. What are some ways where people that are living further away from an ailing parent can help out their siblings that are doing a lot more of the day-to-day activities?
It's a very good question, because many family members, obviously, or families these days, are so split up. And it's called long-distance caregiving. And it's very stressful when an adult child cannot be there with a parent to provide direct hands-on help. However, there are things that a long-distance caregiver can do. They obviously can provide financial support if that is required. And they also can provide counsel. I mean, you should be having the one thing that COVID has done is it's made us all very comfortable with virtual communication, and using Zoom or other tools to communicate will bring in the long distance caregiver and allow him or her to be much more involved in the care of an elderly parent than they would have been, say, 2 years ago. The most important thing is to keep all family members completely informed about what is going on, regardless of where they live. So the reasons that you buy this, the reasons that you made that decision, so that the whole family is involved, and that certainly can be done virtually.
Thanks. Inga, go ahead. There you go. Go
Michael?
ahead. Oh, Leslie, go ahead. Sorry.
Okay. Addison's going to ask the question.
Hi, Michael.
Lawrence.
My question is, when we meet with you for financial planning sessions and we discuss retirement, we've never really discussed long-term care. So we discuss how much we would need to retire. How does that fit in with the long-term care? Or is that a separate conversation or part of that retirement funds that we save and prepare for our retirement? We're also supposed to apportion a certain amount of those for this.
Absolutely great question. And Lawrence, when we do our retirement plans, what we do is we project expenses in retirement. So we have actually our expenses increasing as you get older. And the most important aspect of our retirement plans is we always have our house value, right? And we have our assets above our house value, assuming all the assumptions we make with increased costs of living to pay for the long-term care facilities. So effectively, the number one way that most people pay for extended long-term care is going to be by downsizing the house. So the biggest objective that we have to cover is what happens if one spouse needs long-term care while the other does not. Because what happens then is it's either a split, you don't have the opportunity to sell the house. So credit facilities, in the past what we did is we lumped the long-term care expenses just in retirement expenses. But part of this exercise is to pull these out so you can clearly see them in the financial plan and definitely prepare both the adult children and the parents for these conversations that are coming down the pipe. You'd be amazed that I know we're talking about parents not talking to children and children not talking to parents. There are spouses that don't speak to one another about this topic. So it is something that has to be brought up to the surface. It is already factored into the financial plans, but I do want to make sure you're more aware. Karen, I see a question here from Anne. When is assisted dying becoming law if this is your wish due to the quality of living, quality of life being inferior?
Wonderful question. And in fact, this is one of the issues that we will talk about in the next session. You're referring to MAID, medical assistance in dying, which in fact is legal. It became legal nationally in June 2016. However, there are many restrictions wrapped around it, and one simply cannot decide that you want to have MAID. There are certain tests that you have to pass, and it's quite complicated, but we will talk about it more next session if that's okay with you.
Yeah, they're changing rules around everything. The priorities again today are to make you aware of some costs that are coming, that are potentially coming down the pipe, the planning facilities that you do have at your fingertips, and how to really start preparing yourself for the conversation. So it's getting your ducks in a row, parents being aware of what their finances look like and what their wishes are, and the adult children being able to coordinate with their siblings to take care of their ailing parents. Because none of them are easy conversations. One last big tip for us, Karen. What's the number one thing that you see going wrong for those family meetings?
The number one is probably not having it. The second would be that there is a great deal of disagreement, and there are priorities among adult children, and these need to be worked out because it's all about the parents. It's not about the children. And we all know families have dysfunctions. I don't know of a perfect family. And these dysfunctions can come out loud and clear when it comes to this about mom and dad. So first of all, have the meeting, include everyone in it, lay down the rules through the agenda. And if you have quite frankly, a dysfunctional family, then bring in a third-party facilitator who can, keep everybody's tempers down and allow something to be accomplished instead of constant arguing. Because when there's constant arguing and fighting, nothing gets done. And use my PDF that you're going to get on the family meeting.
So that will be coming out after this presentation. We'll clip this recording and make it YouTube accessible. Send the link out. For those of you that invited your friends, please forward this along to them. David, I see your hand up. You got a question?
Yes.
Go for it.
In terms of the issues with family meetings, what would you advise if a child is estranged?
I would advise that now there's many reasons a child can be estranged. Was it the child's action or was it the parent's action?
Child's action.
Child's action. Okay. I think that what I would do if I were I come from a family of 5 children, and we certainly had our issues, but I would include every member of the family and make sure that the estranged child received all the information, received all the justification about how the money was spent for this and for that. Because if someone is estranged and you don't treat them equally, then you don't know what's going to happen to come up and bite you, quite frankly.
Yeah,
So,
sorry, I didn't mean to cut you off. If I could add to that, I've been through this myself with both of my parents 10 years ago, and I'm one of 7 children, and dysfunction is a slight way to put it. I couldn't, the one thing you always have to remember is what you're doing for your parents. They are the #1 priority. And if you have somebody in your family that is estranged, as long as you keep them in the loop, I think you're doing what you should do.
And again, this is good. It actually goes beyond simply the family conversation, because when you are acting under a power of attorney, there is legal scrutiny as well down the line. So this will get covered in the September session of the wills and electing powers of attorney. And then we'll have also an executor training where the liability just gets even more. So the words of simply including everybody in these conversations are not just because it's the right and proper thing and creates the least amount of resistance throughout the process and nobody's blindsided, but it is to protect legality and not being contested later on in life.
absolutely.
Because if you're taking your parents to and from medical treatments and you're buying things and making their life better, all of those things can be called under scrutiny, especially by an estranged sibling, child, spouse, whatever it might be.
It's important to remember that as a power of attorney, you have to record everything that you do, every penny that you spend, and justify it. And whether you're a power of attorney for property or you're a power of attorney for personal care, because that's part of the job.
Perfect. So guys, fantastic. Thank you so much. Go enjoy your dinners. And I know for some people it's getting late. Our East Coast friends, it's getting late over there. And the West Coast people, enjoy the rest of your evening. So go Habs. Absolutely. If you got to cheer for someone, go cheer for the Habs. Thanks so much, everybody. And
Thank
we
you.
look forward. We'll send out notes. Look forward to see you on the next one.
Good night.
Thank you.
Okay.
Good night.
Thank you. Thank you. Good night.
Thank you. Oh, right here.